amazed and was actually interested in the fact that when Dad was on steroids, his hearing improved.
Yes, it did.
Well,
Not kidding.
You could hear and talk.
my.
Yeah.
It's too bad steroids have so many
Yeah,
downsides.
it
Otherwise, we
is.
just
We'd all be on it.
Yeah,
It wouldn't be an
we could do that.
opioid abuse. It would be
Maybe
steroids.
she had one because she started screaming.
Yeah.
And listen, Dr. Henderson said, whenever you give him these, not steroids, what's that one we're gonna give him for,
The chemo.
A Temenos?
chemo, there's a pill you have to give him an hour before,
Mm-hmm.
but I don't see that in that package that
Oh,
I
the
got.
anti-nausea
There was
medicine.
two things, but it looked like it was both the same thing.
Oh.
It didn't look like there was another.
So we'll talk to him about
Yeah,
that
ask him
tomorrow.
And it
about
came
that.
from CVS or something,
Uh-huh.
whatever. And when we were up here, they asked me if I wanted to go with that or have Rite Aid down there do it. And I told them Rite Aid, but they sent this, so now will it go to Rite Aid after that?
Ooh.
Well, probably your anti-nausea medicine will. These pills were made up.
Oh, right. The actual chemo, it's a kind of a big production. So
Right.
they get
I
all
need-
ready
I
for you
need
to
this-
deliver it.
I need
But
this.
other stuff that goes with it seems like you could get it from your
And I think that's
pharmacy.
right, Mom. I think that the
Okay,
chemo
so-
medicine, they
Okay.
had to make it.
All right. So I'll get a prescription for that other stuff too, so.
We'll talk to him
Because I
tomorrow.
wanna make sure I give that to him an hour before I
Yeah.
give him that.
Yeah.
Right.
So
Amazing.
that's,
I got a glimpse of your incision. I want to take a little bit of
And
a closer
we
look
wanted
at
to
it
know
here.
about the staples because they said the
Yeah.
stitches would disappear.
Let's see, I'm looking for
Back.
staples.
right there, right
Right in there, yeah.
Oh yeah, let's take those out.
Oh boy,
Oh
Dad.
boy, you're getting your steak.
So you are
That's
healing
gonna
beautifully. That is just gorgeous.
He takes his
Yeah.
shower by himself and everything.
So stay put right where you are. and I'll-
She didn't get a staple puller.
He told me I could do that. He said
It does. You'll hardly feel it.
I got my knife here.
Yeah.
Well, you could.
You
Stranger
could.
things have happened. Stranger things have happened. Let me tell you. Okay.
Now, is there two staples or just one?
There's two.
There's two.
Yeah, there's
Okay.
two. I could feel them.
Did you feel that, Dad?
Just a little pinch.
Well,
Wow.
still you're gonna feel it more.
Still.
Yeah. Hold still.
Come
We'll give
on.
you a little haircut.
There we go.
All right, good.
That one a little
Let me just
bit.
make sure we don't have any other hidden staples. There was nothing over here, was there? That was just from the device that puts
Right.
your head in place during surgery. So that's healed
That's
nicely.
what I
It looks
thought.
good, I think. Let me just get a look at you here while I'm over here. Sorry. Let me turn the lights down for just a second. Okay. Will you do me a favor? Will you look at the waterfall over there?
Oh, okay.
Keep looking at it. I'm just going to shine a light in your eyes. Okay. Now you follow my finger. Ready? Don't move your head.
Oh.
Just the eyes. Just the eyes. Can you see it okay? All right. Okay. Open your mouth. Stick out your tongue. Say ah. Great. Okay. Now with this hand here, will you take this finger, touch my finger? Touch your nose. My finger. Your nose. My finger. Your nose. Okay. Can you take this hand and put it in your palm like this? Can you flip it over like this? Fast as you can. Back and forth, back and forth. That's not too
I'm not
shabby.
as fast as you.
That's okay. Not too shabby. Not too shabby.
Okay.
And then one more thing. You can you lift me up with your foot? Bend your foot up. Wow, that's pretty good strength. Down. Now that was if I remember correctly, the up and down was also something that was not quite up to
It's a
par,
little
and that's
hard.
pretty good now.
Yeah.
It seems like
So I'm getting stronger then.
It seems like it to me. You know, you can be strong and still have some coordination pieces of it. So sometimes that still hangs out a little bit. But I mean, that's what therapy's for.
And I do on this hand sometimes.
Yeah.
I try to pick up something, but it's not as easy.
Yeah. And that seems consistent with. And so it's normal to have some kind of lingering symptoms from what you had before. We definitely don't expect it to get worse. If it gets worse, we want to think about that and wonder what's going on. Sometimes it's not ever entirely how it was before.
but you may experience kind of a steady improvement. We just kind of have to see where it lands, but we definitely would be wondering if it got worse, or if you got some new symptoms. So if you had some other neurological symptoms, so kind of anything above the neck, right, that started to happen, like if you became confused, or if you have vision changes, or if your face started to look like one side looked a little weird, anything like that, then that's something that we want to wonder about immediately. Or if your walking gets worse. So if you start to have some balance problems, or coordination problems, or you get weaker, anything like that. Those are all things that we would want to hear about right away.
Sometimes I noticed the last few days, it seemed like, okay, you see everything, but then maybe double vision.
And so is that like where you're seeing two of things, or more than one of
It
things?
seemed like you see something and then there's something else the same, but it overlaps.
Yeah, I would call that double vision.
Okay.
Did you have that before, or is that?
I don't remember having that before.
No, hon.
I noticed it changes a little. And then I sat and I wait, and maybe I don't tell her.
Yeah.
But I just sat there, and pretty soon that vision goes back. Instead of double, it's single.
Okay, so that they kind of merge back together.
Yeah.
Now, have you had that today?
I haven't had it today.
Okay.
I just never know when it might happen.
Yeah. So sometimes you can tell if sometimes it's one eye or the other, and sometimes it's the way the eyes are working together. So when you have it, you could cover up one eye and see if you still have it, cover up the other eye, see if you still have it. A lot of times it's the way things are working together, but if that continues, you could get an eye exam, just a basic eye exam. You could also see a neurologist that specializes in ophthalmology, which is a specialty of a specialty of a specialty. So we have one here across the hall at this neurology group. I have no idea if there's somebody closer for you, but if that continues to be a concern, what I would probably do at this point is get started with your treatment, and see if that continues to be a problem. It sounds like it's pretty occasional.
Yeah.
But maybe let mom know when you're having that
Yeah.
problem so that she can kind of.
I always
And-
try to have everything
Exactly.
down.
Yeah.
Both, when we went into the oncology and the radiology, separate days, they did his blood pressure, and it was a little high, so it was 166 over 80 something. So we did get a blood pressure little guy that we're doing twice a day on him.
Oh, okay.
I don't know if blood pressure sometimes can maybe cause that little bit of a vision thing,
Should
but
be.
just so you
That's
know.
probably more what's going on
Yeah.
upstairs.
I think so, too.
Yeah.
Yeah.
So if that starts to get worse,
I just don't like to tell her everything because I don't want her to worry.
I know, and then you feel like you're complaining, right?
Yeah.
It is helpful though to be able to kind of keep track of how things are going over time.
So I
think
should
it's hard
tell her
I think you should tell her. It's hard to find the balance, right?
Yeah.
Because we also don't want you. We want you to live your life, you know, and enjoy your day, and not feel like you have to spend your whole day keeping track of everything
Right,
that's
we
going
don't want
on.
that.
So,
And I
some
did
kind of
write it
background.
down on the calendar.
Did
You
you?
told me you were blurry one day. I did write it down.
okay.
I'm writing everything down on the calendar.
Because you did say blurry, and I imagine blurry is the same as double
That's
vision.
what he said.
Probably, yes.
Well,
Yeah.
so most people describe if you look and everything just looks like it has kind of a fuzz around it. That's more what we think of as blurry. But what you're describing sounds more like double vision,
That's
where
right.
where you're seeing more than one of something.
And
Even if
yeah,
it's
'cause-
overlapping, it's more than one.
Because sometimes I can feel it coming, and it seems like it goes up, and I'll just sit there, and after a while, it goes away,
It comes back to normal.
and goes back to single vision.
Did you experience this at all when you were having seizures?
That's what I'm wondering about.
Is he still doing seizure meds
Mm-hmm.
Which I think you should be.
or anti-seizure meds?
You're not taking a ton of seizure medication. So, is anything else happening at the same time you're having that vision symptom? Do you feel a little strange? Do you feel like it's hard to talk?
I haven't noticed that. I just notice that double vision.
I was thinking maybe that was one of your seizure problems.
It's an interesting question. So you're taking the Keppra 500, correct?
Mm-hmm.
And you have not seen a neurologist, have you?
No.
Okay.
We seen one last time was when he had the Guillain-Barré.
Mm-hmm.
Right, I see that in here. That's from just over a year ago,
Yes.
right? Okay.
Mm-hmm.
Well, I was going to see if I could find Dr. Roundy to say hello to you anyway, and let's ask him what he thinks about that, because it could be. I mean, it could be a very subtle version of seizures. I don't know. And it's tricky because, you know, we want to have you on as little of the Keppra as gets the job done. And at the same time, it's not a huge deal to take more of it if it seems like you are having some seizure episodes. We could also get neurology involved if we need to. Let's ask Dr. Roundy what he thinks.
And I haven't been too concerned with it because I know if I just sit there
It
and
clears
take
up.
it easy, pretty soon it
Could
starts.
is it?
going away.
How long does it last?
Oh gosh, I would say probably, 3 or 4 minutes?
Okay.
And how often, Dad?
I would say, seemed like this happened